last video, I promise. In here, I just want to integrate all of the aspects that we have described in the autonomic nervous system and explain how they get together to create also a visceral reflex. Now, remember we described in the somatic division of the peripheral nervous system the somatic reflexes, right? The withdrawal reflex, the simple monosynaptic reflex, and a reflex arc is just, these automatic responses or reactions to something. I don't know, I reacted like that, but I don't know how. You removed your hand away from the hot stove and you didn't even know when you were burning, right? Those were the somatic reflexes. We also have visceral reflexes. Now, and we have the same five components we described before for the somatic nervous system. We have a sensory receptor, okay? But these sensory receptors, remember, they are either general or specialized. The general are detecting pain, temperature, stretch. The pain is, remember, activated in these receptors because of irritation, inflammation. Uh, the specialized senses, we have the viscerals are the ones where a chemical is involved. Remember, uh, taste and smell. So these receptors located on the viscera-free nerve endings are detecting or sensing the stimulus. These receptors see the free endings of the sensory neuron. So this information travels and gets, so far, is the same, right? Only that are visceral receptors. So it reaches a sensory neuron. Number one, I have here my receptors. Number two, this information reaches the sensory neuron located on the dorsal root ganglia. So far, so good. Same thing, these fibers get into the spinal cord or to the central nervous system following the dorsal root, okay, and gets either into the dorsal root, dorsal gray horn, or it can synapse with another neuron, motor neuron or interneuron in the lateral gray horn. Remember, this is one thing that changes in here. Okay, the integration center is going to be the same, your spinal cord, but different levels, depending if sympathetic or parasympathetic nervous system. And the motor neuron now in the somatic nervous system was located in the anterior gray horn of the spinal cord. In the latter, in the autonomic nervous system is, and you know that already, your motor neuron are located in the lateral gray horn of the spinal cord. From there, same thing, these motor efferent fibers, visceral fibers, exit the spinal cord following the anterior or ventral root. And they are going to innervate the target, this is number 5, the target organ. But before that, remember, this is a system of 2 neurons. The motor branch or motor division is a system of 2 neurons. So we have the preganglionic neuron here in the central nervous system, and we have a second neuron here in this ganglia. See, a second ganglia. This ganglia is a sensory ganglia where all the somatic and visceral information gets there. And this is a motor ganglia. These ganglia, in this ganglia are located the second motor neuron or the ganglionic neuron of the autonomic nervous system. Nothing to do with the somatic. And then you have the 2 neuron pathway to reach the visceral effector and get a response. Let's see an example. In here, we have the heart, and which is the effector. And the receptors are located right here in, this is a baroreceptor, a receptor that detects pressure. So it's detecting, let's say, the stimulus in here is that blood pressure is high. So it's detected by these photoreceptors. This information is sent to the dorsal root ganglia, and from there it reaches the brainstem. I'm not going to tell you where. There in the central nervous system. It synapses with another interneuron or directly with the motor neuron of the autonomic nervous system. Now, if the high blood pressure is high, I want to reduce the heartbeat. Okay, and that's a way to reduce the blood pressure. So I'm going to activate a motor neuron of the parasympathetic nervous system to decrease, following the two neuron pathway, to decrease the or to inhibit the contraction of the cardiac muscle tissue to slow down the heart rate. This same reflex you can change in here, for example, the reflex of defecation, poo-poo, the reflex for peeing or micturition. Okay, so you can change this effector organ, and you can change the sensation. Let's say that the stimulus is now your colon, your the distal part of the colon where we accumulate feces or poo-poo. It gets stretched, and because of the presence of feces, and that information gets to the spinal cord, and I'm sorry, to the central nervous system. And let's say that the urinary bladder is full of pee-pee, the smooth muscle fibers stretch. This stretching sensation is going to be sent to the central nervous system, and then it's going to activate parasympathetic. Again, I put another parasympathetic example, to contract the muscles of the smooth muscle of the urinary bladder to empty the bladder. Several examples of visceral reflexes. Last but not least, I want to explain one cool phenomenon that is called refer pain. And the refer pain is when, and I'm sure that has happened to you before because it happens to everyone, that sometimes we feel, remember that I explained visual pain before in the first video in this chapter. And this visceral pain is not because we're cutting actually the visceral organ, but because we are chemical irritating or inflaming that, or that tissue is being inflamed. That's what stimulates the visceral pain. Now, sometimes that visceral pain is perceived or felt for us like it's somatic in origin. We can sometimes, feel that. The best example in here is a cardiac infarction or a heart attack. Yeah. Where sometimes, or sometimes the patients refer that they have, say, I have a dull pain in here, and they cannot precise the location, and that's the visual pain, that you cannot pinpoint where it is. What is that is hurting? Is your heart? Is your esophagus? So you start thinking about all the organs present in where the patient is referring the pain. But sometimes the patient says, it hurts in here, it hurts my neck, and my teeth are hurting, and only the left part of the arm and the medial side of my arm. And when you examine that patient, it ends up that he's having a heart attack. And that's what we call referred pain. He came to us not referring visceral pain, the dull, unprecise, or hard to precise pain, but a somatic pain that is easy to pinpoint. We don't understand actually very well what is going on in here, but what is known so far is that the visceral information, the sensory information that is coming from the heart and the skin in those areas, in your lower, in the upper limb, in the left chest, the neck, the part of the skin of the mandible, your teeth sometimes. It gets to the same spinal nerve or spinal cord segments, okay, both the visceral and the somatic. So it kind of like it gets all the information and activates everything, you know. It's not as precise. There's some wiring in there that we are not so clear, but I thought it was a fun fact to bring to you. So here in blue is where some heart conditions or heart affections are felt sometime. Here's where your gallbladder or liver, where you feel the somatic pain of affections of those organs. Appendix, something very common on your age. Well, I'm assuming you're John, not John, but young. Your appendix hurts right here at the beginning. Is a dull, you know, a pain in the entire abdominal, you know, in your abdomen, and you don't know what is hurting. You don't know if it's actually it starts right here in the epigastric area, but then it descends and localizes, and then the patient can say it's right here in the right side. That's the somatic pain of the affection of a visceral organ, the appendix. Like this, we conclude the explanation of the autonomic nervous system. I hope you enjoyed. I hope this was helpful, and see you in the next module. Bye bye.